Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, Professor and Vice Chair for Research in the Department of Family and Community Medicine at Meharry Medical College and Principal Investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL, and Site PI for HealthWorks, a HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, December 19th, 2022. Despite surging rates of new COVID cases, hospitalizations, death due to COVID-19, many adults remain hesitant to get the new bivalent booster. In addition, amid reports about rising flu and RSV cases, parents are now at least as likely to worry about their children getting sick from those illnesses as from COVID-19. While about half of adults nationally say they are worried there will be an increase in COVID-19 cases and hospitalizations in the United States, just about a third say they are worried personally about getting seriously sick from the virus. Roughly half of parents say they are at least somewhat worried that their children will get sick from RSV, the flu, or COVID. As in the past, Black and Latino adults, as well as those over 65, are among the groups most likely to worry about getting seriously ill. Today, I'm going to talk about COVID vaccine hesitancy. I'll follow that up with a brief overview of new research findings about long COVID. Then I will talk about the new plans to make COVID tests available by the federal government and how to get them. I will conclude by providing an overview of the numbers of newly reported cases, hospitalizations, and deaths, both nationally and in Tennessee. Let me start by talking about vaccine hesitancy. A new survey conducted by the Kaiser Family Foundation found that about 4 in 10 adults report that they either have already gotten the recommended bivalent booster shot, about 22%, or say they will get it as soon as they can, an additional 16%. The bivalent booster targets both the original and Omicron COVID-19 strains and has been available since September. Among adults ages 65 and older who face higher risks from COVID-19, about 4 in 10 say that they have already gotten the bivalent booster, and another 16% say they intend to do so as soon as possible. Still, this currently leaves more than half of older adults without protection of the bivalent booster. Democrats are twice as likely as independents and 3 times as likely as Republicans to say they've gotten the new bivalent booster. Vaccinated adults who have not gotten a bivalent booster are largely skeptical about its value. Among this group, more than 4 in 10 say they don't think they need the new booster, and more than a third say they don't think its benefits are worth it. A similar share, 36%, say they are either too busy and haven't had time to get it. Fewer now cite other reasons such as bad side effects from earlier COVID vaccines, waiting to see if cases increase in their area, or waiting until they travel or see vulnerable family and friends than in previous polls. Most vaccinated Republicans or Republican-leaning independents who haven't gotten the new bivalent booster say that they don't think they need it or that its benefits are not worth it. Among vaccinated Democrats and Democrat-leaning independents who have not gotten the updated booster, the top reason is being too busy, of which over 50% have used that reason. Among those 65 and older who are vaccinated but who have not gotten the updated booster, about a third say they don't think they need it and that they don't think the benefit of the updated booster is worth it. About 1 in 4 say they have been too busy or have not had time to get the new booster yet. Currently, all states and the District of Columbia require children to be vaccinated against certain diseases, including measles and rubella, in order to attend public schools, though exceptions are allowed in certain circumstances. Amid controversies around the COVID-19 vaccine and growing distrust of public health authorities, more than 4 in 10 Republicans and Republican-leaning independents and a third of parents now say they oppose requiring children in public schools to receive some childhood vaccines, up since 2019, a new Kaiser Family Foundation COVID-19 vaccine monitor survey found. In contrast, the vast majority of Democrats and those who lean Democrat support requiring the vaccines for public school students, about 88%, little change from 2019, in which 86% favored it. Let me now talk about new research findings around long COVID. The CDC defines long COVID as a wide range of new, returning, or ongoing health problems people can experience 4 or more weeks after first being infected with the virus that causes COVID-19. Symptoms can include fatigue, brain fog, headache, impaired mobility, and insomnia, among other things. The federal data found that over 13% of adults who previously had a COVID-19 infection were still experiencing symptoms of long COVID as of mid-November. Of those adults with long COVID, more than 78% reported that their long-term symptoms from the condition reduced their ability to carry out day-to-day activities. New research findings from the Center for Disease Control, National Center for Health Statistics suggest that long COVID has potentially played a role in the deaths of more than 3,500 Americans during the first roughly 2.5 years of the pandemic. Researchers analyzed death certificates with COVID-19 listed as a contributing or underlying cause from January 2020 through the end of June 2022. The age-adjusted death rate for long COVID was 6.3 per million for the 12-month period ending in June 2022, according to the report. If the survey results were extended to the entire U.S. population, it would mean that roughly 17.5 million adult Americans were experiencing long COVID a month ago, and that nearly 14 million had problems performing daily activities because of it. The long COVID death rate was highest among adults ages 85 and over, non-Latino American Indian and Alaska Native people, and males. So let me turn now to the free at-home tests. The Biden administration announced this past Thursday that the federal government will resume its free COVID-19 at-home test program for a limited time, allowing households to order up to 4 tests as a part of its winter preparedness plan to combat the current coronavirus surge. The program was suspended in September because Congress didn't provide additional funding to replenish the nation's stockpile of tests. Shipment of the tests will start next week, the official said. This initiative is part of the administration's COVID-19 winter preparedness plan announced Thursday that aims to stay ahead of increases in COVID-19 cases and hospitalizations this winter. The test can be ordered at covidtests.gov. That's one word, covidtests.gov, and will start to ship the week of December 19th, a senior administration official told reporters on a conference call. The government is urging people to test themselves when they have symptoms and before visiting with family. It's the 4th round of free rapid tests this year. The White House had suspended the program in September and said it would not be able to send out more kits because Congress denied requests for more funding for the program. But the administration shuffled around funds to buy more of the tests for the national stockpile, the official said. The plan includes guidance for nursing homes and long-term care facility administrators on actions to take to reduce COVID-19 infections, hospitalizations, and deaths. Additionally, according to a fact sheet, Health and Human Service Secretary Xavier Becerra on Thursday will send a letter to governors outlining preparations they should take for the winter, including adding mobile and pop-up vaccination sites, surging testing sites, and test-to-treat sites. The steps come as COVID-19 infection and hospitalizations are on the rise in the U.S. as highly transmissible Omicron subvariants spread. Nationally, by any metric, conditions have worsened markedly this past month. Reported cases and hospitalizations have seen particularly large increases, with both figures up more than 40% in recent days than they were at Thanksgiving. Nationally, cases are up 27% to over 65,000 per day. Hospitalizations are up 16% to over 40,000 per day. ICU admissions are up at 4,600 per day, up 15%, and deaths are up 65% to 409 per day as compared to the previous 2-week average. The test positivity rate is now at 12%, up from 10% 2 weeks ago. Many states have seen cases and hospitalizations increase in the past 2 weeks, and population centers like New York and Los Angeles continue to be troubling hotspots. However, there are some promising signs, especially in the Southwest. The region was experiencing the worst outbreak in the country for most of November, but conditions there are now improving. In Tennessee, Tennessee has seen a significant surge in new reported COVID cases, hospitalization, and deaths over the past 2 weeks. Tennessee currently ranks number 16 among the states for newly reported cases. There are now an average of 1,376 cases per day reported in Tennessee over the past 2 weeks, more than double the average 2 weeks ago of 541 cases. Meanwhile, hospitalizations increased by 48% over the past 2-week period to 627 per day. ICU admissions increased by 12% to 65 per day, and test positivity increased to 14%, a 35% increase over the prior 2-week period. Meanwhile, deaths more than doubled, up 103% to 14 per day over the past 2 weeks. The infection rate in Tennessee is now 1.21 per 100,000 of the population. There are now 9 counties in Tennessee that are in the red zone, up from 4 in the prior 2 weeks. Tennessee counties in the red zone include Washington, Unicoi, Carter, and Hancock counties in the far northeastern region of the state, and Tipton, Gibson, Crockett, Hardeman, and Madison in southwestern Tennessee. There are an additional 12 counties in the yellow zone, down from 24 counties 2 weeks ago. 6 of the counties are in West Tennessee, 1 in South Central Tennessee, and 5 are in northwestern Tennessee. So, COVID is now surging again. The CDC is advising everyone, particularly those who have not received the new bivalent booster, and particularly those who live or will be visiting friends and relatives, to consider wearing a mask indoors, particularly if they will be in counties that are in the red or yellow zones of community risk. While it may now be challenging to get a vaccine during the Christmas, New Year's holiday, please put it high on your list of things to do to start off the new year if you have not yet received it. Wearing a mask in public indoor spaces will provide protection against getting not only COVID, but the flu and RSV as well. So until next year, please protect yourself, your loved ones, friends, and colleagues. Get boosted, wear a mask in public indoor spaces, where indicated, and provide good ventilation wherever possible. For now, this is Dr. Paul Juarez from the Tennessee SEAL and HealthWorks, wishing you a blessed and happy holiday season.